Bismillah ar-Rahman ar-Rahim. Thank you very much to the organizers of this conference for inviting me as a speaker today. It's an honor to be with you and to have this opportunity to discuss this topic on nutrition situation in Algeria and update with such a distinguished audience. The alarming rise in type 2 diabetes is a major public health concern, especially in the MENA region, with its highest prevalence and projected 96% increase by 2045. This coincides with a rapid shift away from the healthy Mediterranean diet towards a westernized and healthy dietary pattern in the region's economic boom. This shift is likely linked to the rise in obesity and non-communicable diseases. Growing research highlights the importance of diet and weight management in preventing and managing diabetes. Diabetes remains a global health crisis despite research progress. High death rate, 11.3% globally, and undiagnosed cases, more than 50%, highlight the need for better management and earlier detection. Now, MENA region faces a diabetes crisis. Highest prevalence globally, 12.2%, is projected to worsen. 1 out of every 8 will be diagnosed with diabetes mellitus by 2045. Unfortunately, 1 in 6 adults are living with diabetes. The number of adults with diabetes is expected to reach 95 million by 2030 and 136 million by 2045. 1 in 3 adults living with diabetes are undiagnosed. 796,000 deaths caused by only diabetes in 2021, and 1 in 7 live births affected by hyperglycemia in pregnancy. Now, referring to the IDF Diabetes Atlas 2021, the prevalence of diabetes mellitus in the MENA will increase by 87% in 2045. Now, let's make an overview on Algeria. Algeria in 2016 had an estimated population of 40 million with around 29% under the age of 15 years and only 5.5% for elderly people. By 2050, the population will increase some 40%, marked by a decrease in the proportion of younger people, 20%, and increase in those elderly people over 70%, which means 9.5 million. Alongside the aging population, diabetes prevalence is increasing, with the most recent statistic reporting 1.7 million people living with the condition and an estimated 693,100 undiagnosed cases. Now, referring to the Global Nutrition Report data, the dietary intakes are displayed on the figure show that some key foods consumption did not reach the target as determined by the Eat Lancet Commission on Healthy Diet from Sustainable Food Systems, as the case of fruit, legumes, and vegetables. Diabetes remains a real challenge in Algeria, with 1.65 million adults with diabetes mellitus. 1 out of 2 adults do not know they have diabetes. According to the IDF data, the prevalence is 7.5% in adults, and the number of patients with diabetes mellitus increased to reach 2 million in 2021. This table displays the diabetes-related health expenditure in $1 million. Algeria spent $513 million, and we spent $814 million in 2035 just for diabetes. As we can see on this figure that not only the diabetes prevalence increased, but also the prevalence of obesity, reaching a prevalence of 27.4% in 2016. According to the World Obesity Atlas 2022, Algeria will get the second highest prevalence of obesity among women in Africa, with a rate of 46% in 2030. Now, concerning the prevalence of insufficient physical activity among adult population in 2016, this number reveals a significant public health concern in Algeria, with a high prevalence of inactivity. Over a third of Algerian adults are not getting enough physical activity. This prevalence is higher among females compared to males. This indicates a sex gap in physical activity habits, potentially due to several factors such as cultural norms, time constraints, or accessibility issues. As you can see on this figure, a significant proportion of children and adolescents are experiencing weight issues, which can be detrimental to their health. Boys seem to be more affected than girls in this case, and several possible explanations can be furnished, like dietary habits, physical activity, social norms, and biological differences. Now, this statement highlights a significant sex disparity in body weight issues among adult population. With a higher prevalence, both overweight and obesity are prevalent, suggesting a large portion of the adult population that might be at risk for health issues. Now, women are disproportionately affected with a prevalence of 40%, higher than men with 25%. This indicates a crucial public health concern in Algeria. Possible reasons for the higher prevalence among women could be included, such as social-cultural factors, hormonal changes, childcare and household responsibilities, or maybe economic factors. Now, as you can see, this figure indicates a worrying trend of rising diabetes prevalence in Algeria among adults. A jump in diabetes cases from 12% in 2015 to over 14% in 2020. The increase affects both men and women, highlighting the need for sex-neutral approaches to prevention and management. Now, the Algerian government combats rising diabetes with a multi-approaches: prevention, early detection, and effective management. This includes national risk factor plans, targeted screening, free essential meds, improved care facilities, trained professionals, public awareness campaigns, and civil society partnerships. Overall, it shows the government commitment to reducing diabetes burden on its citizens. Now, the plan tools aim to improve communication with the population and more especially young people in educational establishments. The axis is broken down into 5 main objectives, and each objective is broken down into actions and measures, as we can see later. Objective 1, promote appropriate nutrition for the state of pregnancy, as well as exclusive breastfeeding up to 6 months. Objective 2, promote healthy eating among children, young people, and adolescents in educational, school and preschool establishments. Objective 3, promote healthy eating among the general population. Objective 4, reduce daily consumption of salt, sugar, fat within the general population. And Objective 5, prevent obesity in general population. Now, concerning the plan, for Action 1.2.1, promoting a healthy diet among children in educational settings with 6 measures from 11 to 16, developing a guide to healthy eating for use by teachers and educational supervisors, establish an intersectorial mechanism to implement recommendations for healthy eating in educational settings. Improve the skills of doctors in school screening unit UDS on healthy eating. Promote good practices in the running of educational workshops relating to healthy eating in educational settings, such as the creation of vegetable gardens and school gardens. Design educational kits for learning about healthy eating for use by teachers and educational supervisors. Measure 16, promote local initiatives for the free distribution of food during recess and installation of water fountains in schools. Okay, in the same line for Action 1.2.2, which aim to develop communication programs and tools on the food and health, with other measures focusing on developing communication programs and education program, developing information and training tools, integrate healthy eating concepts, develop a national framework for communication on healthy eating, involve the media through training in the role of relaying information relating to food and health in educational environments, and include health messages in food advertisements. Now, for objective 3 of the plan, to promote healthy eating among the general population with a view to reduce the prevalence of diet-related non-communicable diseases, reverse the trend in obesity among children and adolescents, reduce the prevalence of micronutrient deficiencies, and reduce the incidence of foodborne illnesses. Now, let's talk about the national nutrition policies in Algeria. Algeria has taken some steps towards implementing national nutrition policies to combat non-communicable diseases, but there is room for improvement. The implemented policies are the mandatory salt iodization, the policy to reduce salt-sodium consumption, the policy to limit saturated fatty acid intake, the operational policy for NCDs, and for diabetes. For the missing policies, the food-based dietary guidelines, the sugar-sweetened beverage tax, the policy to eliminate industrially produced trans fatty acids, the missing multi-sectorial NCD policy, and the marketing restriction for unhealthy products. While Algeria has taken some positive steps towards implementing national nutrition policies, but there is a need for a more comprehensive approach, expanding policies like the elimination of trans fatty acids and marketing restrictions, alongside developing a multi-sectorial NCD policy that could significantly improve the country's effort in combating non-communicable diseases and promoting healthy eating habits. In addition to the previous effort, Sanofi Laboratories has initiated the This Case Algeria program to enhance the diabetology knowledge and skills of general practitioners through digital learning. The program includes 6 online modules accessible via an e-learning platform, followed by face-to-face mentoring sessions for groups of 12 general practitioners. A mobile application facilitates communication and progress tracking between general practitioners and their mentors. Also, the Ministry of Health has released the 2nd edition of the Guide to Good Practices in Diabetology for Practitioners. This 122-page guide, authored by 24 national experts, covers first epidemiological aspects, then diagnosis and classification, type 1 diabetes, type 2 diabetes, complications, secondary diabetes mellitus, diabetes in special situations, treatment of elderly diabetic patients, and optimized oral dental management recommendations for diabetic patients. The health authorities in Algeria, in partnership with Novo Nordisk Laboratories, launched the project called Baromètre Algeria, or in French, Baromètre Algérie. The project aims to assess the quality of diabetes care in Algeria. It tracks 18 key measures based on the IDF recommendations, with the aim to track trends, evaluate care quality over time. Number 2, study complications, investigate the link between care quality and diabetes complications. Number 3, improve quality of life, to identify factors that enhance well-being for diabetic patients. And number 4, to assess nutrition education with a measure of the impact of nutrition education on diabetes management. The Barometer project in Algeria studied over 40,000 adults with diabetes type 2 for 3 to 5 years of follow-up. 9,000 of females vs 5,000 for males with a sex ratio of 0.61. For the age, it was comprised between 18 to 97 years. For BMI, the 3 categories of obesity: 41.2% overweight, 26.5% were obese, and 10.7 with morbid obesity. For long-standing diabetes, on average, participants had diabetes for 8.25 years, with some having it for over 50 years. This figure displays the distribution of patients regarding glycated hemoglobin. A relatively small proportion of patients fall within the optimal A1C range, which means below 7%, 35.5%. A significant portion of patients have levels of A1C between 7 and 9%, indicating a suboptimal blood sugar control. However, a concerning number of patients have very high A1C level exceeding 9% and suggesting very poor blood sugar control. The barometer study recorded 46% of patients with A1C more than 9% without insulin therapy. 34% of the participants had a blood pressure less than 130/80 mm mercury, while 33.5% more than 130/80 mm mercury. 8,750 participants, which means 60%, presented an imbalanced lipid profile. Now, the main observation from the barometer study are the high prevalence of obesity in Algeria that became a worrying reality. It was recorded a shift of the prevalence of obesity from 30.2 to 37.3% in 10 years, and only 25% with the BMI less than 25. However, the values of glycated hemoglobin show an improvement in glycemic control among the studied population. In addition to the previous observations, the study highlighted issues in diabetes management in Algeria. It was noticed a lack of dietitians that appears to be associated with suboptimal dietary practices among patients with diabetes mellitus type 2. Patients lack guidance on diet, mostly following basic internet advice. The physical activity is insufficient and mainly only work with unclear details. Some patients are not on optimal medication dosages, and insulin underutilized for high blood pressure was also noticed. Finally, nearly 20% of patients with high blood pressure were untreated. In conclusion, the findings of Barometer Algeria suggest that dietary measures, which are a crucial component of diabetes mellitus type 2 management, are not being adequately addressed. Now, what about the satisfaction with healthcare services? The figure shows the percentage of people in Algeria, Jordan, Lebanon, and Morocco who reported being completely satisfied or satisfied with their healthcare system over various years. Jordan had the highest satisfaction rate initially, but still experienced a notable decline. Algeria showed the most stability, with only a slight decrease in satisfaction, when Morocco and Lebanon both saw significant drops in satisfaction over time. Now, concerning research on nutrition and diabetes in Algeria, in 2019, a cross-sectional observational study entitled Dietary Diversity as a Risk Factor for Obesity in Algerian Patients with Type 2 Diabetes mellitus involved 390 adult patients with diabetes type 2. The key findings and characteristics of the study are as follows. Data were collected using a standardized questionnaire. A dietary assessment was conducted using a 24-hour recall method to assess dietary intake. The dietary diversity was measured using the DDS, the Dietary Diversity Score. 71.5% of the participants were female The average age of the participant was 57.1 years, with a range from 29 to 88 years. The average duration of diabetes among the participants was 8.8 years. 41.3% of the participants were classified as obese. However, 38.5% were overweight. For the glycemic control, approximately 60% of the participants had a level of glycated hemoglobin equal to or greater than the target percentage, indicating a poor glycemic control. For physical activity, 61% of the participants reported low levels of physical activity. The study provides insight into the demographic and clinical characteristics of diabetes mellitus type 2 patients, highlighting significant issues related to obesity, glycemic control, and physical activity levels. The dietary diversity score recorded in this study was 4.46 plus or less 0.72. The food groups consumed by the highest proportion of patients were grain with 97.7%, followed by vegetables 96.7%, and fruit 92.8%, and dairy 89.7%. However, over 2/3 of patients, 69.7%, reported consuming food from the meat group. In this study, female sex, hypertension, and physical activity were significant predictors of diabetes. Algerian women with type 2 diabetes had a more sedentary lifestyle than men, with 26.5% versus 70.5%. The prevalence of obesity was higher in women, 33.8%, than in men, 10.3%, and hypertension was more common in women compared to men. The dietary score is a good indicator for assessing the relationship between diet and obesity or health risks, but there is a lack of standardized scoring methods. Algerian patients with diabetes had adequate dietary diversity. In conclusion, the escalating prevalence of diabetes poses a growing economic burden on social security systems and government budgets. Moving forward, strategic public health interventions should prioritize empowering primary care physicians, equipping general practitioners with the necessary knowledge and skills to effectively manage type 2 diabetes patients, enhance screening strategies, implementing improved screening programs for early detection of diabetes and its associated complications, addressing obesity, tackling the rising obesity epidemic through comprehensive public health initiatives. Furthermore, strengthening health information systems by enhancing health information systems to facilitate data collection, analysis, and informed decision-making regarding diabetes prevention and management. For the National Diabetes Plan implementation, which constitutes the real challenge, ensuring the effective implementation of the National Diabetes Prevention and Control Plan across all relevant sectors. Now, by prioritizing these strategic actions, healthcare systems can mitigate the rising economic burden associated with diabetes and improve the overall health outcomes of the population. Thank you very much for your attention.